Hi, this is Dr. Kelly Carlson. This short video segment related to strangles will be concerning the treatment of strangles. Since strangles is a bacterial infection, we do have antibiotics which can be effective against the bacteria. Historically, penicillin has always been a good option, as well as several other types of antibiotics such as cephalosporins or potentially doxycycline. You will get some differing opinions, and it's important to consider each case on an individual basis. But for most straightforward cases of strangles, we tend to not use antibiotics right away because it can actually slow down the development of those abscesses in the lymph nodes from rupturing and draining. So sometimes you can prolong the course of disease if you put horses on antibiotics too soon. So myself personally, I tend to reserve the use of antibiotics for those horses that maybe are not as healthy or don't have as strong of an immune system as they should, such as pregnant mares, young foals, or elderly horses. I also will use it for horses that have some of the less common types of strangles, such as pneumonia from strangles or abscesses in the abdomen or udder, or even potentially the brain. So horses that have abnormal presentation of strangle signs might be ones that I think about using antibiotics. In general, though, our prime goal is to keep the horses as comfortable as we can. So we will often use something like Banamine or Bute to help control fevers as we need to. And often a pain medication like that will also make the horses more comfortable, so they're more inclined to eat and drink normally while their throat and the surrounding lymph nodes are swollen. We can also use fluids to help flush out any areas that are draining pus, so lymph nodes underneath the jaw can be cleaned and flushed. And for those horses who end up with bacteria and pus stuck in their guttural pouches, we can use fluids to flush those out as well.